Hello, my name is Christopher Gardea, and today I would like to talk to you a little bit about medicinal marijuana, its advantages and disadvantages. Many people shy away from the subject either because of its legal ramifications or moral opposition. Like so, when the term marijuana is brought up, many questions arise as well, such as, should it be legal? Is it a gateway drug? Or how do I keep it out of the hands of my kids? These and many more like them are all relevant and pertinent questions, but they have no bearing on medicinal marijuana or its palliative care properties. And for that, this speech shall serve. To better illustrate how much medicinal marijuana has impacted the US, please refer to the map next to me. According to the National Conference of State Legislatures 2019, 34 states, including the District of Columbia, Guam, Puerto Rico, and the U.S. Virgin Islands have already adopted some form or use of medicinal marijuana in their province. Alike, the map also depicts to what degree medicinal marijuana has been allowed in that region. Aside from talking about medicinal marijuana's advantages in palliative care, I'll also be touching bases on its various side effects, and this being the very reason why it is so important to talk to your medical provider before starting any new medication. First thing to remember about talking about medicinal marijuana is that first word, medicinal, which means to tend or use to cure disease or relieve pain. In fact, Dr. Peter Grinspoon, a doctor at Harvard Medical School, affirms that the main reason why medical marijuana is used in the US is for pain control, and that part of its allure is that it is far safer than opioids, far less addictive, and impossible to overdose from. However, this doesn't mean that medicinal marijuana doesn't treat other ailments as well. In addition to Dr. Grinspoon's findings, a report formed for the Committee of Health Effects on Marijuana 2017 found that medicinal marijuana not only improved the livelihood of those dealing with pain, but expanded to such areas like nausea and vomiting associated with cytotoxic chemotherapy agents, HIV/AIDS, multiple sclerosis, PTSD, and seizures and epilepsy, just to name a few. Notably, in an article I came across called The Townsend Letter, The Examiner of Alternative Medicine by Clotter and Dr. Rosso, 2006, it stated that 1/3 of the patients dealing with HIV/AIDS medicate with cannabis therapies to not only alleviate pain, but nausea, vomiting, and AIDS wasting syndrome. Alike, according to Tadaro's 2012 findings in the Journal of National Comprehensive Cancer Network, nausea and vomiting are also common side effects attributed with cancer patients who have been administered cytotoxic chemotherapy agents. And yet in reality, there are so many side effects that come with any medication. In fact, referencing Kern Neuropharmacology 2017, medicinal marijuana's effects vary from between light and heavy uses and can include feelings of intoxication, cognitive and perceptual distortions, and anxiety. Furthermore, the Mayo Clinic staff 2017 cautions those with mental health conditions as it may already worsen a debilitating disorder, such as people with bipolar disorder. The slide shows various side effects associated with consumption of marijuana, to include dry mouth, dizziness, and increased appetite. The Mayo Clinic furthers the concerns over the drug and warns against driving or operating heavy machinery. And additionally, long-term inhalation can worsen pre-existing respiratory conditions or even create them. Like so, the Mayo Clinic warns against medical marijuana's anesthetic effects and urges against consumption of medical marijuana at least 2 weeks before any type of surgery. Given the Mayo Clinic's findings in inhalation usage as it pertains to respiratory conditions, there also exists other forms of consumption of the drug as well, such as oral absorption of cannabis oils through the mucous membranes of the mouth, ingestion such as brownies and gummies, or topicals like transdermal patches. At this point, do the effects or disadvantages of medicinal marijuana outweigh the advantages it offers in palliative care? Well, that is just one of many questions arising at our state's capital in Austin, as lawmakers argue from each side of the table. In addition to a statement made to the Texas Tribune, Samuels 2019, spokesman for Lieutenant Governor Dan Patrick, Alejandro Garcia, stated that the Lieutenant Governor is strongly opposed to weakening any laws against marijuana and remains wary of its various medicinal proposals. At the same interview, a similar statement of opposition was heard from the Executive Director for the Texas Municipal Police Association by Mitch Slaymaker. He said that their concern for expanding medicinal marijuana cannabis would only facilitate more violence and crime associated with drug abuse. As it can be seen, medicinal marijuana has many advantages and disadvantages, most which go on to be debated on a daily basis on Liberty Hill. However, the fact remains that medicinal marijuana is only meant for palliative care and not for recreational use. It would seem that the various side effects compare very little to the care it renders for those who conventional medicine failed. Alas, it is up to the lawmakers to decide if the ends equal the needs of the many. I hope this presentation has enlightened some of you into better understanding medicinal marijuana and its many people that it serves. Thank you.